Good afternoon, everybody, and welcome to Housing is Healthcare, unlocking the doors to stable housing for people living and aging with HIV. My name is Malcolm Reed. I'll introduce myself last, but I'm going to introduce our wonderful panel of advocates. First, we have Kadeem Morris from the Community Legal Services. Next, we have Kay Greenberg, staff attorney for CHLP, the Center for HIV Law and Policy. Then we have Carrie Thomas from Zero Project, Turn It Up, and Lauren Banks from the National HIV AIDS Housing Coalition. Once again, I'm Malcolm Reed, CHLP Aging Consultant, and I will be moderating this panel. Today, we're going to talk about housing as healthcare, and we've got, as I mentioned, 4 experts. So not much need for me to moderate. I'm going to let these wonderful advocates talk and tell you what they do. And so I'm going to go back through the list. Kadeem, tell us about yourself, and then pass it to Kay, then Carrie, and then Lauren. Tell us about yourself, and then we'll get the conversation going.
Sure thing, Malcolm. Thank you guys for having me today. My name is Kadeem Morris. I am the co-managing attorney of the Housing Unit at Community Legal Services of Philadelphia. Our primary area of focus is landlord-tenant eviction prevention. We also co-lead the Philadelphia Eviction Prevention Project, which is targeted at keeping Philadelphians safely housed for as long as possible and as efficiently as possible. And as you kind of started our saying, housing is healthcare, and our goal is to make sure we have a safe and healthy city. So happy to be here and share expertise with you and your panel today. Mr. Greenberg.
Hi, everyone. My name is Kay Greenberg. I am, my pronouns are he, him. I'm a staff attorney at the Center for HIV Law and Policy. We're an abolitionist organization that works to destigmatize people who are living with HIV and other stigmatized conditions, and, decriminalize HIV and other stigmatized conditions. And my work at CHLP focuses on the aging work and also bodily autonomy and data privacy. And with that, I'll pass it over to Carrie.
Yeah, thank you. Thank you, Kay and Malcolm and Kadeem. Great to be part of this panel. My name is Carrie Thomas. I'm the policy strategist at with Zero Project, and also the editor-in-chief of Turn It Up, Strong Inside, the magazine that goes inside facilities to provide resources and start a conversation, actually, of what needs that we need. And then this topic is right in line with the folks that are returning to the communities. We're giving them a space, a platform to share their experience and to work solutions so folks can make that transition and be successful further on in life. And I am passing to Lauren, I believe.
Thanks so much, Carrie. I'm Lauren Banks. I'm having a little bit of problem with my video, but I will get it working very shortly. My pronouns are she and her. I'm the executive director of the National HIV AIDS Housing Coalition. We are a national nonprofit that seeks to provide housing policies and resources to advance the health of people living with HIV. What that means is we do a lot of federal advocacy to work for appropriations for the Hopwood program, for HUD funding, supportive of Ryan White funding, and then assisting grantees and jurisdictions on the ground for how to best implement programs that are supportive housing, housing first approach. I work with all different types of people, no matter their background, meeting them where they are and making sure that housing programs are effective. So we do technical assistance and we do advocacy, and we are so delighted to be here. So thank you for having us.
Excellent, excellent. Thank you all for being here. So let's start here. I guess for about the first 20 minutes, let's find out about people living with HIV and criminal records, and then we'll talk about subsidized housing and the current state of HOPWA funding, and then we'll roll into the right to counsel and fair chance legislation. So Kay and Carrie, I'm going to start with you. Why do people living with, and I'm not saying all people, but why do people living with HIV have criminal records, and what are the collateral consequences? Kay, I think you're on mute.
Because I realized I had done a wrong thing on the slides. I apologize, everyone. So so let's talk a little. So why are we talking about things like criminal records and we're talking about people living with HIV and aging? So one thing that we want to start with is defining what HIV criminalization is. Some people may be very familiar with this. Some people might not be. HIV criminalization refers to laws, policies, and practices that impose heightened criminal penalties on people living with HIV for conduct that is not criminalized or criminalized less severely for people living with HIV. What that looks like is either people who are criminalized under what are known as transmission, like under like a transmission law, where allegedly someone did not tell their sexual partner that they were living with HIV, and then that person reports them, and they are criminalized under that law. Or it's potentially talking about things such as enhancements. For example, for sex workers who are living with HIV, in many cases, charges for sex work are misdemeanor charges or lower level charges. For many people living with HIV, they are felony charges. This is particularly important just to think about because it gets to some of the issues with these laws that I'll get into a little bit more later. So one of the things that at CHLP that we have are a series of maps that are put together by my colleagues who work with the Positive Justice Project. And these show the way that HIV criminalization works nationally. So this doesn't break things down into levels of severity, it breaks it down into levels of specificity. So essentially looking at the different ways in which HIV can be criminalized in different states. One of the things I want to draw people's attention to is in some states, they don't have an HIV specific offense, meaning that there's not an offense that specifically targets people living with HIV or other stigmatized health conditions. What I mean by that is in some places, things like Hep C or HPV or things like that are also tied up in these laws. But people are instead criminalized under the general criminal code. So, for example, could be charged with reckless endangerment of another person, aggravated assault, up to and including things like bioterrorism, which has been charged before. So even though that there's not an HIV specific offense, people are still criminalized in ways for living with HIV. So what do these laws have in common? So it's important to note, so this kind of lists a bunch of things that all of these laws generally have in common. Obviously, state by state, the specific aspects of the laws differ, but it's really important to note that what they tend to have in common is that engagement in behavior that poses a risk of transmission is not required. So I was talking about the ways that sex workers, for example, to be charged under a sex worker enhancement is a felony. In many cases, when someone is charged with sex work under that enhanced penalty, for example, in Pennsylvania, to be charged with prostitution, which is the technical term under the legal code, the Commonwealth just needs to show that there was a conversation that involved an agreement was come to that involved the exchange of money for a sexual act. No physical act, no physical connection of any kind needs to have taken place. Most of the people who are charged under this law are charged as a result of police stings. A sex worker who is living with HIV who gets picked up in the police sting, in which there's literally been no physical contact of any kind, it can be charged as a felony under Pennsylvania law as it stands right now. So it's important to note that these laws not only have no basis in science, they are obviously being interpreted in such a way as to criminalize people with HIV and to increase the stigma put upon them. They are also utilized in very racist ways. The Williams Institute has gone state by state in many of the states in the country, not all of them, and has done reports looking at who essentially gets arrested, who is targeted under these laws, and primarily it is Black people who are prosecuted under these laws for this conduct. So these laws are add to stigma, and then are also used specifically to target people, and therefore only add to increase the stigma, and in fact act counter to their hypothetical reason. The hypothetical reason behind these laws is to somehow promote public safety, but in fact it encourages a lack of public safety. It encourages a lack of things such as testing. So what is another reason why we're talking about people living with HIV and criminal records? So looking at this slide, so it lists a bunch of facts and statistics. But what I'd like everyone to do while they're looking at this is to picture a Venn diagram in their head, okay? Like then those Venn diagrams, those are the ones with the two circles that overlap, okay? And in one of those circles, let's talk about the people who are vulnerable to HIV and tend to be the people who are showing the fastest rates of new HIV cases, which is primarily Black people in the South. And then in the other circle, let's imagine the people who are targeted by the criminal legal system generally, which is also primarily Black people. And then look at the overlap. And that overlap in that circle there is why when we're talking about people living and aging with HIV, is one of the reasons that we're talking about people who are likely to have criminal records. And I'll go into a little bit more about why that is with this next slide. So looking at this next slide. So let's look at all three of these reasons together. Again, we're kind of building on that Venn diagram I just explained. So the number one is we talked about HIV criminalization and the ways in which that plays out. Two, the targeting of Black people, primarily looking at things like the ways in the war, the results of things such as the war on crime, which was a reaction to the civil rights movement. The war on crime started in the 70s and 80s, and we started incarcerating more and more people. And then we also did the war on drugs in the 80s, and we started incarcerating more and more people for longer and longer periods of time. The age of people who are incarcerated is raising because people are having longer sentences. And actually today we are incarcerating people who are older in ways that we never did before. Between 1970 and 2017, the US prison population went from around 196,000 people to just shy of 1.5 million people. So we're looking at those numbers increasing. And then also we're looking at the targeting of LGBTQ plus people. And part of that is due to the engagement of LGBTQ plus people in things such as survival crimes, meaning because discrimination in many ways against LGBTQ plus people is legitimized under the system, they find themselves kicked out of housing, kicked out of employment, kicked out by their families, and need to move to things in the gray and Black market economies in order to survive. And again, this brings them in with the criminal legal system. And this is the slide I was just describing. I apologize. I realized I did not advance it. So another reason that we're talking about this here is going to these demographics. So these are a bunch of demographics that show the relationship of people living and aging with HIV to the poverty line. Why, again, are we talking about this here as it relates to people living and aging with HIV having criminal records? When one is accessing all of these services, it is a situation so people who are living below the poverty line are likely to be accessing various government services, such as subsidized housing, such as SNAP or food benefits, such as welfare. Each of those services brings them into contact with the government in multiple ways, and each of those services subject them to more and more surveillance. These services are services of essentially exclusion. They're consistently looking for people who are abusing these services to be kicked off of them. And what's the result of finding out that somebody is, quote unquote, abusing these services or committing fraud? Is criminal legal action. And for example, again, in Philadelphia, there's even the district attorney's office literally has a unit that is dedicated to prosecuting things such as welfare fraud and such. So, and this is, we're only going to be seeing the impact of this being worse based upon the ways in which we are currently watching our social safety net being dissolved more and more and more. So we're going to have people, again, turning to more survival crimes and things like that in order to make ends meet. And we're also going to, as the screws are tightened and as money is drained from the social services net, again, they're looking at ways in which to constantly be searching for fraud. For example, in one of the aspects of the Medicaid rollout is that people are going to have to certify for their qualifications every 6 months. These are all points at which people are going to be subject to scrutiny, and they're going to be looking for ways of kicking people off the rolls because the services are not going to be funded at the levels necessary to provide all of these services. So these are all things that play together for why people are living and aging with HIV have criminal records. And with that, I'm going to pass it to Carrie to talk to us a little bit more about things.
Yeah, thank you. You explained that perfectly. If we can jump ahead a couple slides. Because what I want to spend a little bit of time on is talking about what it's like. Kate does an excellent job of showing the numbers of what it looks like to get people with their situation. As a person who's formerly incarcerated after serving 15 years under Idaho statute for HIV criminalization, 15 years of a 30-year sentence, I want to take a little moment and talk about what the conditions look like inside while you're aging with HIV. And then oftentimes the challenges are more simply kind of trying to get your medication. One thing we know with HIV, with the need to have consistent regimen of medication is the number one challenge that we have. That to if you're going to live a long life and a full life, which we know that medication does, what allows us to do, we also need to have access to the medication in a consistent method. There's a lot of the challenges that while you're inside of getting the medication, simply that it's not available. Or oftentimes there's the stigma, but why are you taking that type of medication? So the peer pressure that comes along with that. And even the way that the medication is distributed, it's not a one-on-one as if you're seeing your doctor or your pharmacist in this case. It's oftentimes that you are bunched in with a lot of people with a variety of different medical conditions, which also leads to mental health cases with difficulties that people may have. So I'm aging, I'm a person living with HIV, I'm aging inside the correctional system, but then we don't have access to the mental health support. Yes, you may get limited access to your medication, but the supporting things is that people, as a person living with HIV, the medication is not everything I need for whole health to become well. Mental health, often correctional facilities are not designed to, or are they a mental health facility? And so now we're gearing things to get proper medication regimen, help with your mental health, all with the idea of you're going to be released back into the challenges that we're going to talk about as we go through this presentation. And then that even combines more when you're talking about nutritional needs. Yes, there's 3 meals a day inside correctional facilities, but as people are aging with HIV, there's a lot of other issues that come along that can be addressed with proper diet. Whether that if they're having a diet that addresses diabetes or being pre-diabetic, a diet that allows people to process the nutrition that you need to be on the medication, have successful. Those are things that are limited. Again, I want to highlight that are limited while people are aging with the hope of getting out and living with HIV in general. Next slide, please. And I think that it's real important to understand that whatever the sentence is, it's not a death sentence. It's not that you're sentenced there to do a period of time. In my case, it happened to be a 30-year sentence. So I wasn't sentenced there to die. But the sentence, what they did send me to, I was faced with a health crisis behind the bars, which with my meds being delayed, other signs of treatment being delayed. And it can be very, very hopeless situation, if you will. If for people who are really trying to make the effort to move on with their life and to serve their sentence, with, again, I can't say it enough, with the hopes of getting out and return to the community. I think that the goal of when you're incarcerated, and this is my verbiage on this, the goal when you're incarcerated is to start your reentry on day one, to start shaping a lifestyle that's going to help you when you get out, and recognizing some of the challenges that we're going to face. And so we're not going to be able to do those things if we don't have the foundation that prepare us, even at the level of education that's needed to know what the challenges are going to be. Next slide, please. And we sum that up by reentry isn't a reset. Oftentimes when we're released from incarceration, it's that you are free is the idea. You're free to live your life and go on. And as we're talking about in this thing, reentry is not a reset. Reentry actually starts the beginning of a trail to lead to a more fulfilling life and be an active member of the society. Are we happy to be released? 100%. But also we want to stay released. And it's not a simple matter of getting out, but what the tools that we need to stay out, those are what the challenges that we're facing. And so reentry turns into, I think we call it stable housing or secure housing is number one. And it's extremely difficult for folks that are aging, that are living with HIV and have a criminal record. There's so many barriers that keep us from being able to secure the housing that we need. Oftentimes people are spending a good portion of their sentence in a halfway house. Halfway house isn't stable housing for many reasons. And one, we don't get the opportunity to develop a rental history if you're in a halfway house. And so sometimes a halfway house may be designed to be a 6-month stay until you quote unquote get on your feet, but that's not what's happening. Because there's so limited housing available, people aren't able to get to the house to build the stability that they're going to need, whether that's to get an education loan, whether that's to secure a car loan, and whether that's to secure even a job in some instance. The need for stable housing can't be understated, and that's not something that's available now. So you can't, which also, upon release, because a lot of systems don't have the medication available upon your release, you don't have a physical address, then when you go to a clinic, it increases more challenge to get the services that you may qualify, but you don't have the stable address. And so all those things can really add up over time that really impact what it looks like to return back to society. And I think it's interesting. I'll speak to my personal experience, and it was kind of an aha moment. Because when we talk about recidivism and why people are going back, it's not that folks are creating more crimes to go back. It's more the falling through the cracks and where there are technical violations, for lack of a better term, that'll send people back. That keeps us rotating back in and out of the system. It's not because people are going out there and still continuing to cause harm. What folks are doing, they're finding the challenges that are related to when you're incarcerated, how the best way to deal with that. And I think it's a conversation definitely worth having, because I think that we all want to do, and especially we talk about the age folks who are aging inside incarceration, exacerbated by folks that are aging as people living with HIV, with the steps or the treatment or the services are not available in order to make that a successful transition.
And thank you, Carrie. And I guess, like you were saying, like essentially, housing it is seen as the root of health. I mean, that's why we named the webinar this way. And we are seeing, even though we know that having stable housing is the root of access to good health and good health care, we are seeing programs such as Housing First programs and things like that. They're being targeted and dismantled in such a way that is taking us the opposite way of what we're going to be going to. So I was just going to try to kind of take us a little bit more broadly before we pass to learn about some of the housing options for people living with HIV, and then also some ways we can use to counter some of the problems that Carrie and I are talking about, which is collateral consequences. So everyone has probably heard the sentence at some point in their life, you do the crime, you do the time, or something like that. And there's this, based upon the idea that there's a perception that, you know, that if you believe that the criminal legal system is a good way of dealing with harm, which I personally do not, but then you do your time, and then, you know, you're done because you have paid your debt to society. But the reality is that people who are convicted of crimes then face a myriad of collateral consequences. Nationwide, there are more than 45,000 state and local laws that are collateral consequences. The one that most people tend to be the most familiar with is the loss of voting rights. Again, when you're incarcerated, you lose your full access to all of the rights of citizenship. You lose all of it's in some ways referred to as civil death. And then upon your release and your completion of your sentence, your completion of your probation, completion of the parole, collateral consequences are what keep people from fully regaining those rights. From the right to vote, like I said, is the one that folks are the most familiar with, to having access to trouble accessing employment, to the lack of ability to apply for federal loans for school if you have a drug conviction, up into including such things as the org that Kadeem works for now, that I used to work for, actually got a big victory in Pennsylvania a few years back, where it got rid of the rule that limited the ability of people with a criminal conviction to get a hair braiding license in Pennsylvania. So things such as that, again, the things that people need in order to rebuild their lives, in order to re-enter society. These are still limited even after someone has, quote unquote, finished their time. And these all play together to kind of, again, have different levels of the ways that they impact people. So we have collateral consequences are lifelong. So we have the ways in which they do formally limit things, such as services and things like that. But then a collateral consequence of being involved in the criminal legal system is also impacts your feelings of safety and your ability to be safe, and also the ways in which you are, again, subject to heightened government surveillance. And again, a lot of what we're talking about are things that are cyclical, that essentially, you know, you're trying to move forward, and then you just find yourself circling back because there are all of these roadblocks that are placed in people's way. The one that to talk about that is the most relevant to housing is the collateral consequences, as it relates to housing. So unless a jurisdiction, or like a town, city, state, has specific legislation, private landlords can 100% discriminate against people based upon their criminal record. That does not mean that they could have blanket bans. Those have been found to be what's called de facto discrimination, or discrimination without calling it as such, on the basis of race. So they cannot ban anyone who has a criminal record, but basically anything short of a complete ban, unless there is laws that are passed to the contrary, is 100% legitimate. And then we also talk about subsidized housing. So with most subsidized, not all subsidized housing programs, but with most subsidized housing programs, and those subsidized housing programs are where a government entity pays a portion, if not all, of your rent, or owns the property that you are living in. And specifically the programs I'm going to be talking about are the ones that are funded in part through HUD funding, so through federal funding. There are only 3 times that are complete bans. One is you cannot live in subsidized housing if you are a lifetime sex offender registrant. You also cannot live in subsidized housing if you have been previously convicted of making meth on public housing property. And there's a 3-year ban for drug crimes. Other than that, there's not complete bans. However, a lot of discretion is left to the local housing authorities. And I can tell you, based upon experience, they use that discretion very widely, moving to evict people on the basis of arrests, moving to evict people on the basis of basic criminal convictions for things such as simple drug possession or, simple assault, or things that are considered low-level misdemeanor crimes. So even though the list of bans is not long, the ways in which it plays out and the ways in which it impacts people living with criminal records having actual access to affordable housing through the subsidized housing programs ends up playing out on the ground is very limited. However, there are options and there are things that exist. And with that, I'm going to pass it to Lauren Banks so she can go into a little bit more about detail about that.
Thanks so much, Kay. I really appreciate it, and I'm glad to be with all of you today. I'm so glad that all of the discussion that we've had today. One of our board members at NAC is a trans woman who was arrested for aggravated prostitution and was charged with a horrible sex worker crime, and aggravated because she had HIV, and because of that was not only able to vote, but of course getting housing is really difficult when, as mentioned, when you have these records and things stacked against you. They're just compounding. I'm also happy to say that Michelle joined the ACLU and others and sued. And so now her sex offender status is removed, which is wonderful. So as she continues to age, she will have a myriad of housing options available to her now that weren't available before. So that's just a story to kick off. Next slide. The National HIV/AIDS Housing Coalition is a national org, as I said, who we are and what we do. So I'm going to go ahead and skip this one. Hopefully you were here earlier and heard what we do. Got to keep you all awake on a Friday afternoon. All right. I want to make sure everyone is aware of a heinous executive order that came out in July of this year. And this executive order is called Eliminating Crime on America's Streets, or something like that. I'll put it in the chat when I finish presenting, because it's worth reading the actual language so that we know how people are being presented and attacked. And so it eliminates funding for Housing First and other harm reduction strategies. It absolutely promotes criminalization of those who are experiencing homelessness and criminalizes and is very punitive on people who are publicly using drugs. The executive order seeks to do this through making discretionary grants contingent upon whether your jurisdiction is committing to these. So most recently in a HUD Continuum of Care grant application, the new criteria was just to check yes or no, including does your city forbid harm reduction practices? Does your city use criminalization, those types of language things. And it was yes or no. And the first one to get their application in gets the grant. So it also removes some oversight of the point system that so many of us are used to. And so we're seeing this come from HUD. This might also come from SAMHSA and from HHS. And so we need to be aware, because the executive order seeks to increase police presence in order to tackle the unhoused problem, right? It also brings back forced institutionalization. And it is those jurisdictions, those police, those systems that get to decide who's forced into lifetime institutionalization in some cases. So I want to make sure that we're all aware of this executive order, because it is, while it's not aging specific, we don't want anyone to age in a lifetime institutional situation, right? But it is so much about increasing criminalization based on one's housing status. So I will put that in the chat in just a second, and make sure we can follow up. Another NAC is we've had a webinar in this executive order. We will have more, and we'll make sure that all of you are aware of what we're doing as it relates to suing on this webinar and training everyone else. Next slide. All right, so here are some fast facts on aging and housing. Hopefully everybody knows that housing is associated with better health and a 20% increased likelihood of being virally suppressed. As time goes on, more and more people are those who are over 50, who are in shelters. So a third to half of people in shelters are over 50 in New York City. And then a person experiencing homelessness over age 50 is considered geriatric. So by default, those who are unhoused, who are older or who have been unhoused for a long time, present with the same medical needs as those who are geriatric. 46% of HOPWA eligible people were 51 or older. And HOPWA is the program called Housing Opportunities for Persons with HIV/AIDS, HOPWA. It is within HUD, and it is the only dedicated source of housing for people living with HIV. Almost 4% of Ryan White clients age 50 and over were experiencing housing instability. That's a relatively low number. So that's good, right? And we know that the Ryan White program can provide these wraparound services that help people stay housed. 2/3 of HUD assisted residents are dually eligible for Medicare and Medicaid. So what does that tell us? It tells us that people are older and people also have disability or are incredibly low income, right? So HUD really funding HUD programs is really imperative for us to make sure that we get housing needs met for those who are aging with HIV. And then nationally, not HIV specific, more than half of older adult renters are cost burdened. And so this means that people are paying more than a third of their discretionary income towards their housing. For those who don't have incomes, once they're older, incredibly strapped for cash. And so that is a compounding problem. Next slide. This is a chart from Ryan White from 2023 data, which is the most recent, just showing how housing does make a difference on healthcare. So for those who are stably housed, viral suppression rate is almost 92%. Unstably housed drops to 85%. And then homeless drops to 79.7%. So you can see this tier right away. Of course, it gets more complicated when you don't have anywhere to put somebody for housing who is homeless or unhoused. Next slide. I want to make sure everybody's aware that, yes, Ryan White can provide housing. HOPWA, as I just mentioned, can provide housing. And each program can provide different things as well as similar. So you can read this slide yourself of what Ryan White can provide, what HOPWA can provide, and what both. A notable change is that in July of last year of 2024, HRSA made the decision that Ryan White can be used for rental deposits, which is wonderful. So before, the Ryan White program could assist you if you had a place to live and help you for 24 months with your rent. But now it is that Ryan White can do your rental deposit as long as you can document how you will get that deposit back if and when the client moves out, right? So that is a huge change, and that is something that we should be using for older folks as well. Even though it's 24 months, get them housed for those 24 months and work with them to have a long-term solution. So I often say we should be using our Ryan White dollars that we can for short-term housing and get people housed right away, work with them on a long-term solution, and if they need more assistance, then transition them to HOPWA, which does not have a time limit. And also, Kay had mentioned some of the reasons why people cannot be housed in HUD programs because of criminalization. HOPWA is one of those programs that does allow use for housing, not looking at criminal records, which is wonderful, and that's one of the differences with HOPWA, which we'll get into. And then also the HOPWA program can provide housing for a longer range. Let's see. I see a couple questions in the chat, and I will 100% get into that. But I do want to really quickly acknowledge what Sophia asked, which is, could I dig more into what the sexually dangerous persons means for the executive order? We don't know, Sophia. And that is part of the worry that we have at the National HIV/AIDS Housing Coalition, which is, what will be considered sexually dangerous? Will that be someone who is raping others, or will it be someone who is transgender? Is it someone who is living with HIV? We don't know exactly how that is going to be interpreted, which is why it is very, very worrisome. Okay, so back to this slide, which is the difference between Ryan White and HOPWA, and then both. These are our HIV federal streams of funding. We should be using them to the maximum of their abilities. Next slide. Here's where HOPWA funding sits and has been for the past couple of years. I love this slide because HOPWA is one of the HIV programs that has seen an increase over the years, which is amazing. So in 2017, HOPWA was funded at $356 million, and then in 2025, it was funded at $505 million. I also want to put this in context that HOPWA is less than 1% of the HUD budget and is only a quarter of what where the Ryan White funding level is. So when we talk about we have a housing problem, and I see Abdul's comment about the global South, that is not obviously going to be exacerbated with all the international aid cuts, but domestically in the United States, there is a huge gap of what HOPWA can actually provide versus who needs it. So a lot of times people say HOPWA doesn't work. Well, it doesn't work a lot of times because we don't have enough dollars to get it, right? So what did the president do? The president decided this year to zero out the HOPWA budget, like goose egg, zero. This budget does not appropriate any funding for the HOPWA program. So that was terrible. And the Trump budget also sought to eliminate 40% of all rental assistance programs at HUD. Thankfully, Congress sees this very differently. And so the House actually flat funded HOPWA at $505 million. Woohoo, yay. And the Senate did even better. The Senate marked HOPWA up by a 5% increase. And I put the wrong figure there. So I need to I'm going to put this in the chat here. But it's $529 million and a $24 million increase. So plus up HOPWA by $24 million to $529. So even better than what I put on the slide, right? But it's still a 5% increase. So we are working really hard to get the Senate number approved. So all of you seasoned advocates who might be on the call, reach out to your members of Congress and say, take the Senate number for HOPWA, because HOPWA absolutely needs to be better funded if we're going to end the HIV epidemic. And think about this. In America, there are 100,000 people living with HIV who experience homelessness every single year. 100,000. That's about 10% of the population of living with HIV are unhoused. What happens? What happens when you're unhoused? Who are you in more contact with? You're in more contact with police, especially with this executive order that seeks to increase police presence. So we have people who are interfacing more with police. We have people who are interfacing more with people who might be dangerous. We have people who are having to engage in survival sex. So different than a choice sex work situation, but survival sex. Also then putting them at risk for more HIV criminalization if they're with the wrong person, or if they disclose, it could be violent. All of these things are so related, and we know that that the aging population is rising so much on those who have HIV, but also those who are unhoused. We have these pockets of youth and older folks, and so I want to frame this as like, the longer that we let people stay on the street, the longer that we are okay with over 1 million people being homeless every single year, 100,000 of them living with HIV. We are doing a moral disservice, and we are also increasing the potential for a lot of legal problems in the future. Continue. All right. I realize I'm talking a lot, so I'm going to try to wrap up quickly, run through these slides. So we need to know that HOPWA serves about 65,000 individuals with housing assistance, and 66% of this is for permanent housing. So what the Trump budget is trying to do is to dismantle permanent housing programs. Secretary Turner has said that HUD should be a trampoline and not a safety net. He used about 4 terrible analogies and lots of sports to say that we cannot have people permanently rely on HUD for support. And as Valerie Pinkston, one of NAC's interns, so eloquently shared with a Senate staffer, she said, "Where am I to go? I have been living with HIV. I have other comorbid conditions now, and there's nowhere else for me to go in Mississippi, and I can't bring in more money." We need to tell the story over and over about why it is that people who are aging need permanent housing support. It's a no-brainer to me. They're not, but we need to tell the story because we are at risk of all people who are older losing housing assistance, not just those living with HIV, because there are so many housing programs that serve people living with HIV. And so if we start to just cap it at 24 months, we're really going to have a disaster on our hands. Continue. I also want to share that HOPWA serves people who have a criminal record. HOPWA has been able to serve those regardless of their immigration status, because HOPWA does not require you to prove anything. That, I fear, is changing with the most recent grant contracts that I have seen. But HOPWA does have some flexibilities. HOPWA provides case management, employment counseling, food assistance, transportation assistance, non-medical transportation, which is just awesome for people who need to go to work or go to church or go to visit family. You can use HOPWA to get them a bus voucher. And then HOPWA does provide the spectrum of emergency to permanent. Continue. Kay brought up the recertification of Medicaid happening every 6 months. And what we worry is that a lot of people are going to lose their Medicaid. And when people lose their Medicaid, then they're going to need to use Ryan White, right? And so as Ryan White then picks up many new clients who have lost their Medicaid or lost their health insurance because of increasing premiums, it's all connected. Then they're going to need more Ryan White for medical, which means Ryan White might have to stop but will probably, I say probably because it's up to each jurisdiction how they use their money, but could potentially say, we're not going to do as much housing. Last year, Ryan White provided 24,000 people with HIV with housing assistance. So we need to make sure that Ryan White funding keeps happening. But if Ryan White gets cut, and then also we have more people losing Medicaid and going on to Ryan White as a core medical service provider will probably not house as many people. And then where are they going to go? And then the eviction risk rises 25% when families lose Medicaid. So 1 in 4 families who lose Medicaid will be evicted. So you see what I'm saying? We have multiple problems here. And remember about how many folks at HUD are Medicaid and Medicare enrollees, right? Remember that from the last slide. Next one. Okay, so resources for housing. Let's talk about I laid out a lot of problems, and I apologize. We can use housing, we can use HOPWA, we can use Ryan White. Neither of those programs have gone away. Neither of those, HOPWA was flat funded last year. It was not cut. Don't let the fear get into you yet, right? Or hearing that Trump zeroed it out. It hasn't happened. We still have these resources. We need to use them. And if we don't use our resources, that's when we put ourselves more at risk. Through HUD, there is Section 202. So households must be headed by someone 62 or older and then earning less than 50% of median area income. So we're talking about moderately to very low income people. So that is elderly housing. There are increasing LGBTQIA aging centers and homes. We need more of those. You can use the 340B dollars to create your own housing. And you could do that specifically for people who are aging and build a really awesome housing and health center. I would love to see more of those and to work with any of you on the call who are interested. But we've got to build our own housing. We just have to. We have got to have some fundraisers, go to some banks, apply to foundations, marry it with some federal dollars, use those 340B dollars, get creative and build our own housing because no one else is coming to build it if we don't. The folks who are building housing a lot of times, most of the time, are those who want to make money off of the top 10%, right? They're not excited to build affordable housing mostly. We need to train our workforce about how to work with people who do come into an assisted living facility or an aging facility about HIV. And then, as I just named, we need to increase housing supply. Next slide. Aging in place. 93% of adults 55 and older want to remain in their homes as they age. Shocking. They want to stay in their home. Don't blame anyone. I'm the same way. So there are programs, you can use HOPWA or Ryan White to age in place. And so these are, you can use HOPWA for reasonable modifications for your home. So if you want to, get rid of that bathtub and have a shower that you can walk into, if you need a ramp, you can, and say you're living in a HOPWA program that's owned by another agency, they can use their dollars to outfit your place to comply. So we need to make sure that people know that and what they're entitled to. I don't need to leave my HOPWA housing that I've lived in for years. No, you can use that money to modify it to help me. Got it? So that's really great. And then we have supportive services. Section 8 through, I don't have this written down, but Section 8 through HUD is a major place that people who are aging, not a place, but it's a program through HUD that you can get vouchers. Section 8 also, it's called Housing Choice Vouchers. And you can also select that you're older. You can specify what type of home that you want. Unfortunately, Section 8 waiting lists are really long. Just like HOPWA waiting list. And this is not going to change unless we get more federal funding and also if we're going to increase housing supply. Also, Section 504, home repair funding through USDA. So USDA has funds. So for those of you who are in rural America, you can go apply for these grants or loans, and you can get a grant and a loan, and that's to modify your house. So for folks who want to add on to make their house a little bit better as they're aging and you're in rural parts, look up USDA housing funding. So that is great. I could say a whole lot more, but I am going to stop right there. So thank you very much for your time.
Thanks, Lauren. So with that, I'm going to pass it over to Kadeem, And Kadeem, tell us about the right to counsel and fair chance legislation.
Thank you so much, Malcolm. I think before I jump into that, there's so much that has been said by both Lauren, Kay, and others that I want to really pick up on and frame in the issue that we are discussing today. When we think about the impact of criminal histories on the ability to access safe and affordable housing and then improve your health outcomes, we're not only thinking about the individual themselves who's experiencing that, but it also has collateral consequences for family. We spent a lot of time just now talking about subsidized housing and the access to those services. And it's the individual themselves who might be trying to get into the system, but often their families, if they are trying to transition back into those households, that can often face threats of removal from these systems. So as we frame kind of the collateral consequences and the broader conversation about how we show up in defense of or in support of the right to healthy, safe, and adequate housing, we really have to think big picture about, like, there's the immediate individual in front of us, and there's everyone who maybe just wanted to show up as a support system, but are often legally barred from doing so, because your mom, for instance, could face removal from her subsidized housing unit if you come into that unit with a criminal history, and that might be the only place that you have to go to serve your probation outside of a halfway house. And those sorts of systemic barriers are very present in society today. And Lauren spent a lot of time talking about aging in place in the elderly population, and there's the pressure on HUD funding. And then there's what at least we've seen in Philadelphia, significant increases in rent. And that is having an impact on elderly households being able to afford to stay where they are. And the limited access to subsidized housing is also creating its own issues. So this is really like a multi-phased problem that has a very clear center or impact on your ability to live safe and healthy lives. So I just wanted to kind of flag that as a common theme throughout as we kind of talk about what do we do next. So the question that I was tasked to kind of present on is, like, how do we fight back? How do we make the system work better for individuals? And how do we preserve access to housing or remove barriers for individuals trying to access housing as either living and maintaining or re-entry and trying to gainfully engage in that system? So I'm going to talk a little bit about the Philadelphia Eviction Prevention Project and how Philadelphia has evolved its eviction defense model. You can advance to the next slide and I'll just give like a brief overview. So nothing works as well as public shaming generally does. So Matt Desmond wrote a book in 2016 that kind of, or pre-2016, that chronicled evictions across the country and what the demographics looked like for cities. And one of the cities that was flagged was Philadelphia, which had a really high eviction rate and also had a strong demographic of Black single mothers being evicted through the system, often for as little as $2,000. And there was kind of what we would call if someone went through the system once, they were more likely to go through the system again, because that's just how the eviction cycle worked, kind of similar in the way the criminal justice system would work. Like, you are more likely to re-enter that system. And the city, notably so, felt a lot of shame about being called out in that way or highlighted in that way. Philadelphia does have the distinction, or we used to be the largest poor city. Now that's been taken over by Houston in some kind of weird way, but we're still pretty poor. So we kind of invested through city council hearings and advocacies through the mayoral administration in attacking the problem of poverty and housing poverty. So the mayor created an eviction prevention task force. There was a stout report that was done to really say, what interventions can we do to change people's experiences with the system? And how do we preserve people's access to housing? Because the most affordable home, and often the safest and best home that you will be in for most people, is the home that you're already in. The actual cost of moving someone to a new home, just the financial cost, and then you add the emotional supports and often loss of labor that happens in that time period, and some resultant trauma, particularly for kids who are in school and have to transition, are significant. So we like to the best extent possible keep people housed. So we really started a very strong citywide campaign. And I say citywide campaign because the forces that work across the state of Pennsylvania are not as supportive to the movement as they should be. I think that's the most diplomatic way that I can say that. So this was a city-based campaign. So when you were thinking about how can we show up as organizations where we are to kind of address the issue of housing instability and resultant health instability, one of the questions that should be asked at the top of the conversation is, who is my audience and what can my local elected officials or organizations do for me? So the city, being a city of first class, has some levers that could be pulled. And one of the things that we were able to do is pass legislation at the city level that first started with good cause. And what good cause meant was that if you had a short-term lease, you couldn't be evicted because the landlord just wanted to get rid of you. Oftentimes, with gentrification and other models that were coming through the system, money was coming in the door, people were being pushed out to rehab units, and as a major poor city, those people have to go somewhere, and the more often you move, the more unstable you become. So we really tackled that issue as a first starting point with that legislation that has been in place, I think, since at least somewhere around 2018 or 2017, and really set the foundation for what could come next in terms of our right to counsel legislation. We managed through the campaign of showing that legal services or providing legal services to people in their time of crisis can work to build out our right to counsel program. Shout out to Kay, who was our first lawyer of the day in that system, kind of the guinea pig to show that intervention in the court system, meeting people where they are and giving legal representation really has a very clear impact. I think the info that Stout came back with when they did the report was for every dollar that we would invest in legal services on the front end, it would save the city about $13 on the back end in avoided shelter costs, in loss of employment, in services that people would need, like food pantries and all of the emergency services that get mobilized in that really rapid way that cost more if they're not being provided to someone who's stably housed. So that is where that model came from. And we were able to build up to a 5.6 as of last year. I think we're closer to $6.3 million program that serves roughly in the neighborhood of 4,000 Philadelphia families every year through legal assistance and services. And the goal of that program, as I said, is to keep people stably housed. We can jump to the next slide. So what are the services that the Philadelphia Eviction Prevention Project through its Right to Counsel model provides? So we are a fully coordinated in-court support system. Oftentimes, we know that people are in need and people are in crisis, but the immediate crisis of housing only shows up when someone shows up at their door with a notice or they realize that they have to go to court. So they're not proactively seeking out supports unless they're connected with one of your organizations and have that relationship. So we have a hotline where people can call and get information and resources, courtroom navigators in court to explain what the court process is, coordinate and provide resources, whether that's connections to legal representations or flyers, referrals to rental assistance, referrals to other agencies. We have a walk-in help center or walk-in intake at most of our partner organizations, financial counseling, pro bono representation, and direct outreach to vulnerable parties. And if you live in one of the 8, I believe, if that number, there should be 8 zip codes. There are 2 more that were added last year. If you live in one of the 8 Philadelphia zip codes where right to counsel has been fully implemented, you are somewhat guaranteed to get a legal consultation and often legal representation if you are facing housing instability. So jump to the next slide. This is just our partners. I'm not going to spend a lot of time talking about it. It's a consortium of legal aid services providers that are making the program work. So lawyer of the day, as I said, that was Kay. Kay started that program for us. It is in court, same day legal representation. So when we meet people who are in need of that service, we are there in court. I would say we are civil public defenders, although that term is not always loved, but we are there in court as a stopgap to kind of do emergency medicine for housing We assess the needs of tenants who are in court, assess the resources that are available to them, and decide what the best outcome can be based on the information that we have. Oftentimes, cases are resolved the same day in civil and especially housing court, which I think is a stark difference from a lot of people's experiences with the criminal justice system, where there's several bites at the apples or delayed proceedings. So often when people come to court, there's not the expectation that you are in court that day with an attempt to resolve your matter that day. People often like, okay, great, when do I come back? And then you tell them, no, we're going to resolve this in maybe an hour or two maximum. And that, I think, is often shocking for people. And housing court is one of, I think, the few court systems where you can go in on the first day of your court date, and if you have no support and no knowledge of what is happening, you can walk in and probably be disposed of your house within roughly 2 weeks in some parts of the country, because like housing evictions can take place in as little as 10 days. Across Pennsylvania, I think it's a minimum of like 21 days for most places, but in some areas of the country, it can be really rapid. You go into court today, you have no support, and the judge rules against you. And 10 days later, there's someone showing up at your house to potentially put you out of the house. So our Lawyer of the Day program is really successful at intervening at that point. So just in terms of our client experience, they come in, they show up to court, they get connected with a navigator. The navigator talks to them about the legal process, explains what resources are available. If they need an attorney, they're connected with an attorney. It is a very high pressure environment. We haven't quite tweaked how to kumbaya court yet. It would be nice if we could have a space where it's lovely, calm, and relaxed. And yes, we have private offices for client consultations, but you're still in that high energy, high volume space where at any given time in a small room, there are like 150 to 200 people facing evictions every day, just kind of cycling through that place. So what generally happens, we have three kind of options models for people based on where they are in the system and what we can provide. Most people get some form of legal representation. For the vast majority of cases, because our goal is to keep people stably housed, we are looking for some kind of settlement or resolution or agreement between the parties that allows people to stay in their homes. Not always the case, but for most people, the majority of evictions filed in Philadelphia are for money. There may be, I would say, maybe 10 or 20% have some sort of termination of term because of the end of the lease or a breach related to them. The majority of cases are for money. And that is, I think, typical of when you live in a major poor city where people who are vulnerable to all of the plights of poverty are facing the system. So for most people, we are trying to get them situated, either connecting them with rental assistance or other resources ahead of time. For cases that are a bit more complicated, Lauren mentioned a few subsidies with which we are familiar and often work with. Those cases often get continued to resolve issues or make sure people get connected with the resources that they need. And a small percentage of our cases do go to trial, and then there's a judicial decision that will come from that. So in Philadelphia, and what I love about this is that the program recognizes need in two ways. There are the very poor Philadelphians who are generally at or below 120% of the federal poverty limit, who are in need of a lot of services and can generally access most services. But there's also the group of people just above poverty, and I know we encounter them as service providers every day, who are struggling to make ends meet and who cannot provide or cannot afford to go out and seek private lawyers or private legal representation. And they are also captured by this program because we go up to 200% of the federal poverty limit or 80% AMI. And that way we can capture a broader range of people who are in need of services. And just in terms of like other supports and resources, we have the navigators in place. We have a help center, we have financial counseling, and which connects them both with rental assistance resources and also with just like talking you through, if you are going to enter a payment plan, what does that look like? When are you getting paid? What is your payment schedule? Can you actually make these payments that you are proposing? That 5-minute conversation where someone actually sits down and thinks and recalibrates, I don't get a check for the next 2 weeks, so I can't agree to make a payment by the end of this week, is often very like it can be the difference between you having a breach in 2 weeks, where then you're on the defensive when you're in court facing a judge being like, you made this agreement, why didn't you make the payments? And you having the time necessary to be able to get yourself together and get your home a little more stable. I think we can skip this slide and this one also. We can skip this too. Right to Counsel is our kind of largest program where we go up to 200% of the federal poverty limit, and it's in several zip codes around the city. Our goal is to make it citywide at some point, but we are not there yet. So in terms of our workflow, I think one of the things that we are really proud of is that we do proactive outreach to people who are facing eviction or housing instability. So there is a list that is published by the court ahead of time with their hearing list. We get that hearing list, we screen for eligibility for our services, and we send out mailers, and we do outgoing phone calls to people throughout the community. And then we get them connected with our resources intake they can do walk-in intakes, they can do phone intakes, they can even do online intakes. Our goal is to meet people where they are, and then they're provided with legal representation by one of our partners. So we can, I think we can back, we can go forward. So I'm going to talk about our eviction diversion program, which is a really new program that has been in the city of Philadelphia post-COVID. It is, as it sounds, kind of in the same way ADR would sound in the criminal sense. It is a program that is designed to keep people out of the court system or prevent an eviction from being filed. So as I said before, a lot of the cases that have come through in Philadelphia in the eviction space or in the housing instability space are all about money. So how do we prevent those cases from going to court just for the sake of saying, you owe me $10, how will you pay me the $10? Because one of the collateral consequences, in addition to criminal records of going through the eviction process, is you have an eviction record, which is often used as a scarlet letter against you when you are looking for future housing. So if everything else could be great, but you have a single eviction on your record, and all of a sudden you are looked at as a less favorable tenant, who someone doesn't want to rent to or doesn't want to have in their place because they think you're not going to pay. So our eviction diversion program combines rental assistance with mediation and housing counseling to provide tenants and landlords a forum by which they can come together and discuss the issues that are existing in their case and figure out a way to frame and address those issues. What we do is there is up to $3,500 of past rent assistance and an additional 2 months of forward going rent. So that can keep a family stably housed for about 5 months, give or take, if rent is at or around, I cannot do math. I'm going to say if rent is at about $1,500, you could probably get up to 5 months of housing stability out of that program. And there's also a moratorium of sorts on future eviction processes where you have to wait up to 90 days before they can try and re-engage with the system. So it really does provide that necessary bridge for household members who are trying to kind of work through the system. I'm not sure where we are on time, but I'm going to, I think, jump through a couple of things and kind of talk about what is possible. So I think in terms of how can you and your community show up in an eviction defense posture, it's making sure that whether it's funded or done through a bar association, partnership with a law school, or a small legal nonprofit, make sure there is some form of eviction defense work that is happening in your city, in your housing court. And there's often grants that are being done at the national level through Results for America and other nonprofits. HUD, I don't know if they've been cut yet, but HUD does have some grants in support of eviction defense work that are available to nonprofits all across the country. So we encourage you to pursue those, and they are supporting the build out of eviction diversion programs and all of those other sorts of work. So that is a great way to make sure that your jurisdiction is working towards making sure that vulnerable parties are actually housed, because once they're housed, then the work is to keep them housed. If they're not housed, there are additional barriers that Lauren has done a really good job of explaining to potentially getting them in. subsidized housing is something that we don't want anyone to ever lose. So if you have someone on a subsidy, any sort of program or supports that can be put in place to kind of keep them there is wonderful, and we fully support that, and there's funding out there to talk about that. I'm going to kind of, and Kay, tell me how this works. I'm going to talk through the Renters Access Act in Philadelphia. It is our foundational piece to hopefully get in towards a ban to box for criminal records. So the Renters Access Act was passed shortly after COVID ended. It is a bill that provides clarity to prospective tenants and also people in this context who would be trying to re-enter into housing. It does not have a full ban on the use of criminal records. That is something that is coming in the future, but it does have a requirement that that criteria for screening prospective tenants are laid out clearly so that tenants know, or prospective tenants know, what to expect when they're walking forward. So if you are looking at a unit, you should be able to see what the landlord is looking for, what they're using. There's not a blanket eviction prohibition, which is, I think, a good first step towards advocacy for the ban on the use of criminal records in this context. But there is a requirement that if you're going to be denied, you have to be notified and given a chance to challenge anything on that record. There is prospective legislation in the city of Philadelphia that mirrors the legislation that is currently in place in New York City, where it would use or limit the use of criminal records until after you've made a decision on whether or not you want to rent to someone. I think Philadelphia has the statistic. I don't know what it looks like in other places, where about 1 in 5 Philadelphians have some version of a criminal record, and either the person renting themselves or a member of their households. We also have a significant youth violence problem, which can often lead to very young children with criminal records that may come back to haunt them in like 5 or 6 years. We've had a very strong, very successful ban the box and employment campaign. So we are mirroring that kind of movement. So it really does create like a 7-year prohibition window and specific things that landlords or housing providers would have to do if they want to use criminal records. And I think Kay talked about this earlier. The restrictions are very limited in terms of like, it has to impact the health and safety of other tenants or be drug-related criminal activity, and those are the bans. In the subsidized housing space, there is kind of some of this framework already in place, although it is very discretionary, where there used to be HUD guidance that clearly said just an arrest alone isn't enough to remove someone or threaten their subsidy based on criminal conduct. There has to be a conviction, and it has to be somewhat related. Our housing authorities are getting better at being more proactive around that work. So there is published information on the kind of crimes that would be considered restrictions and what sort of mitigating information should be presented, but there's always more work to do. And I do think as resources become tighter at the federal level, they are going to look for ways to cut corners and cut costs. And one of the easiest ways to do that is use criminalization as a pretext for some form of discrimination. And that is something that we should continue to fight and keep them on their heels with. I think I'm going to cut off right here because I'm not sure how much time we have left.
Well, all right. Thank you, Kadeem. Thank you to Carrie and Kay and Lauren. So now we have time for questions. I'm looking in the chat. I really only see 3 questions. Well, one is a comment from Heather Powell. In Missouri, this is during Carrie's presentation. In Missouri prisons, they give you the oldest meds, and that should change as well. Carrie, do you have any experience with HIV meds in prison? And
yeah, I think that's when I saw that in the chat, that was right on point. And because most of the systems, they're outsourcing their medical department, meaning that it's not being run by the facility; it's being run by a private company. And so there's going to be a formulary of that to save money in order to get you meds. So it's rare for HIV meds specifically, they had to get a waiver in order to get the med. That also causes the delay in treatment and not to say the quality, but getting the specific medication that you need according to the medical literature that we have available. So that was right on point.
Okay. And I know during Lauren's presentation, she referenced Abdul's comment, the Global South's people living with HIV, especially key populations, face significant housing challenges. How can we bridge the gap? Does anybody else want to weigh in on that question? All right, having none, I will move to Sydney. Sydney Singh says, regarding the Trump executive orders, will they likely set a lasting precedent?
Yeah, I'll respond to that if that's okay.
Mm-hmm.
Yeah, and actually, Trump's executive order comes on the heels of the Supreme Court's decision last year, Grants Pass versus Johnson, which said that it is legal for jurisdictions to arrest people who are unhoused, for existing on public land. So. Yes, I'm definitely afraid that it will have lasting effects. And this is not Democrats are coming to save the day moment either. If you've been following Gavin Newsom and some of his policies as well, this is very much a popular thing among many people, Democrat and Republican, to increase police presence with those who are unhoused. So yes, we should all be aware and pushing back and using our data about how housing works and works in a good way for no matter the person, right? And Housing First is under attack. So Housing First program. So I think it's important for us to name what Housing First is, which is supportive housing. So we need to hands-on supportive housing. So we can still keep doing it. Let's just tweak the language a little bit and show people what supportive housing does, and push back. And our pushback needs to be at the local level 100%.
Thank you, Lauren. So Max Boykin says, what can we do more to adequately advocate for those living with HIV who are currently incarcerated as we continue to see rises in horrible prison conditions?
Just and Carrie, also feel free to pop in if you want to take it, but putting on, I guess, kind of a half hat as a public defender. I mean, there are nationwide, there are a lot of, and this also gets to the fact that a lot of things are, kind of siloed and cut off, and the fact that like a lot of the services that are focused on HIV aren't necessarily focused on people in the criminal legal system. There are nationwide, there are different organizations, like in Philadelphia, there's the Pennsylvania Institutional Law Project that bring cases and bring suits on the basis of on prison conditions. And then there's also things that are done to try to get people out, such as like compassionate release. There's also movements like the CADB, which is the Coalition Against Death by Incarceration, which is basically, there's obviously people are familiar with like anti-death penalty movements, but there's also a movement against these very long prison sentences that keep people incarcerated and are for a very long time and are part of the issues that we see with the rising numbers of people in prison because people are being incarcerated longer. The other thing is actually things like ban the box legislation and things like that Kadeem was talking about are actually really important because, again, like I said, I was a public defender. A lot of times when you're trying to get someone out, you have to have someone for them to go to. Nursing homes can discriminate on the basis of criminal records. So a lot of times nursing homes and supportive living won't take people who need, and I'm not saying that, won't take that people who level of care. So even though it's not necessarily HIV specific, ban the box will actually help address some of that issue that you're pointing to, Max. The other thing, and it's kind of one of the ironic things, but actually one of the things, I'd left the public defender's office by the time COVID started, but one of the things that came out when COVID was going is that they were actually, because some of the unsafeness, because things were so bad, it was actually able to use as leverage to get people living with HIV actually out of prison because of the level of risk they were at while incarcerated. So in sometimes some of the conditions can actually be used as a basis for getting people out because they are so bad. They raise Eighth Amendment cruel and unusual punishment issues and safety issues, which is one of the many awful truths about the criminal legal system and the way that it works. It's so bad that things are, and it was actually something that when I did work with like trans folks who are incarcerated, who would be stuck in administrative segregation, which is the equivalent of the hole, which is 23 and 1. Things were so bad that you could actually use it as leverage to get people out, which is one of the terrible things. I hope that a couple of things that help speak to that.
Thank you, Kay. Carrie, did you have a response as well?
No, I don't. I just only would echo everything that Kay said, but with the compassionate release, at least in the West, at least in Idaho, the biggest the hang up is that, like you're saying, there's no place for people to go. And so I guess one thing that we can do to help is to provide places to change the rules that allow people with criminal records to go to something like a senior center, or them to go to not the halfway house system, but to devise a different system that allows people a place to go that will support all the needs that the people have. And I know firsthand that there are folks who could have been released after doing a lot of time, but said they had no place for them to go.
Wow. Well, all right. Well, thank you. I see that there was another question from Janice, but it looks like Lauren's got that taken care of. Janice, please reach out to Lauren. She left her email in the chat. And that's about 340B, money for housing, and a couple of other comments about ban the box and 340B in the chat. So with that, I think we're at time. Kay, did you want to provide any wrap up?
No, I guess I say no as I start talking. So don't ask a lawyer to talk. It never goes well for you. No, I just thank you everyone for joining us, and thank you all of the speakers for agreeing to be a part of this panel. I really appreciated hearing from each of you. Myself, I love when I do panels and I'm like, oh yeah, I'm learning new things. I'm learning new things about the 340B program, which so you learn new things every day. Mm-hmm. And please join the email list for CHLP. We have the Aging Primer, which is a resource document about legal issues for people living and aging with HIV. Blow up my inbox. Would love to hear from people about more of things that you want to hear, if you have questions or comments, anything like that. So thank you everyone for attending.
And I will echo that. Thank you, everybody. You could have been doing something else with your Friday afternoon, but you chose to spend it with us, and we definitely appreciate it. And I also echo what Kay said. I learn something every time I do a panel or every time I facilitate a panel. So I'm grateful to the panelists. So thanks, everybody. Enjoy the rest of your weekend, and we'll talk soon. Good work.